Yellow fever, a viral disease transmitted by mosquitoes, was first recognized in the English-speaking world in the late 17th century. The earliest recorded outbreak identifiable as yellow fever occurred in Barbados in 1647. However, the disease was probably not distinctly recognized as a specific ailment until the outbreak in New York City in 1668. The term, yellow fever, itself began to be commonly used in the 18th century, reflecting the jaundice that affects some patients. Yellow fever is a viral disease transmitted primarily through the bite of infected mosquitoes, specifically the Aedes aegypti species in urban areas. The infection process begins when a female mosquito bites an infected human or non-human primate, acquiring the yellow fever virus. This virus then circulates in the mosquito's bloodstream and settles in its salivary glands. When this infected mosquito bites a human, the virus is transmitted into the human's bloodstream through the mosquito's saliva. After entering the human body, the virus replicates during an incubation period that typically lasts 3 to 6 days, during which the infected person usually shows no symptoms. Following the incubation period, the acute phase of the infection begins, characterized by symptoms such as fever, headache, muscle aches, nausea, vomiting, and backache. This phase generally lasts a few days, and most people start to improve after this. However, in severe cases, some individuals may progress to a more dangerous toxic phase within 24 hours of the initial symptom remission. This phase is marked by a return of high fever, the development of jaundice, yellowing of the skin and eyes, hence the name, yellow fever, and bleeding from various parts of the body. There may also be a deterioration in kidney function. The toxic phase can be fatal. The outcome of yellow fever varies. While many patients recover completely after the initial acute phase, the disease can be fatal, particularly for those who develop the severe toxic phase. It's crucial to understand that yellow fever is not directly transmissible from person to person. It requires a mosquito as a vector for transmission. Vaccination is the most effective means of prevention against this disease. Yellow fever is a viral disease with a range of symptoms that vary in severity, typically unfolding in distinct phases. Initially, after an incubation period of 3 to 6 days following exposure to the virus, individuals often experience acute symptoms. These include a sudden high fever, severe headache, muscle aches, particularly in the back and knees, chills, loss of appetite, and nausea and vomiting. This phase is also characterized by general weakness and fatigue. Following these initial symptoms, there is often a brief period of remission where symptoms improve. However, in more severe cases, the disease may progress to a toxic phase. During this phase, the fever often returns, and more serious symptoms can develop. These include jaundice, where the skin and whites of the eyes turn yellow due to liver damage, abdominal pain, and vomiting, sometimes with blood. Bleeding from the nose, mouth, or eyes can also occur, signaling more severe hemorrhagic symptoms. Additionally, kidney function may decrease, leading to less urine output. In extreme cases, brain dysfunction such as delirium, seizures, or coma can occur, reflecting a very severe infection. It is important to note that not everyone infected with yellow fever virus enters the toxic phase. Many people recover after the initial set of symptoms without progressing to more severe complications. However, the toxic phase of yellow fever is associated with a high risk of death, making early detection and supportive medical care critical. Supportive care focuses on treating symptoms like dehydration, respiratory failure, and fever, and reducing the risk of secondary infections. There is no specific antiviral drug for yellow fever, highlighting the importance of vaccination for prevention. Treating yellow fever involves supportive care, as there is no specific antiviral treatment available for the virus. The primary goal is to alleviate symptoms and prevent or manage complications. Treatment includes the use of medications like acetaminophen, paracetamol, to reduce fever and relieve pain, while avoiding aspirin and NSAIDs due to their potential to increase bleeding risk. Adequate rest is crucial for recovery. Hydration and nutritional support are key aspects of treatment, particularly if the patient is experiencing symptoms like vomiting and diarrhea. Fluids can be administered orally or intravenously, depending on the severity of dehydration. A balanced diet helps support the body's recovery process. In severe cases that require hospitalization, continuous monitoring for signs of organ dysfunction or other complications is critical. Blood transfusions may be necessary in cases of severe bleeding, and supplemental oxygen is provided if respiratory distress occurs. Dialysis might be required for kidney failure. Maintaining a clean environment and using antibiotics to treat secondary bacterial infections when they occur is also important. Although yellow fever is not contagious from person to person, patients may be isolated to prevent the spread of the virus to mosquitoes, which could then transmit the virus to others. Vaccination plays a crucial role in prevention but does not contribute to the treatment of an ongoing infection. It is recommended for people in endemic areas or for those traveling to such regions. Prompt medical attention for anyone exhibiting symptoms of yellow fever, especially if they are in or have recently been to an area where the disease is common, is vital. Early diagnosis and supportive treatment can significantly improve the chances of a successful recovery.